if you have a stroke or you have a head injury, it would be a good idea to get light put on your head relatively quickly, within hours maybe, or 24 hours, but relatively quickly. And that could have a big preventative effect because, as you know, the damage from a TBI or a stroke spreads in the days, maybe even weeks after the event.
Welcome, everybody, back to another episode of Wellness at the Speed of Light podcast. I'm your host, Dr. DR.SINICROPI, and I could not be more thrilled to have Dr. Michael Hamblin, the foremost authority in the world on everything photobiomodulation. His resume is so incredible. It's just hard to describe how much he's done in this field. And he is absolutely somebody that is a mentor to so many of the up and coming professors of the world and people that are interested in photobiomodulation. And I thank you so much, Dr. Hamblin, for coming on the show today. I've waited a long time to get you on the program, and I can tell you at our hypercharge clinics where we do a lot of photobiomodulation, people were in awe that I was able to get you on the program today to talk somewhat about your experience in this field, talk about the history, and really explain to people why this is going to be such an instrumental part about the way we heal our bodies, going forward into the future. So on that note, thank you for being on the program today.
Oh, well, you're welcome.
Can you tell us, just to get started, what initially even interested you in the field of photobiomodulation? How did this come about? Did you have a professor? Did you have a family? Did you have somebody that said, hey, you should look at this light therapy stuff? It may be something that in the future is going to really change how we treat the human body.
Well, the way it started, I got my PhD in synthetic organic chemistry, and what organic chemists do is look at fancy compounds, and some of the fancy compounds I was interested in were what are called photosensitizers. So these are generally dye molecules, very deeply colored, that efficiently absorb light and then do photochemistry. So the energy of the light produces chemical reactions which end up usually producing what are called reactive oxygen species. So these reactive oxygen species can kill cells and damage tissue. So this whole procedure was called photodynamic therapy, and it was originally used to treat cancer. Since then, it's been used to treat infectious diseases because the ROS can kill cancer cells, it can kill bacteria, viruses, fungi. You can remove unwanted tissue. So you can do a lot of medical things with PDT. Worked in PDT in the Wellman Center for Photomedicine at Mass General Hospital. But after a few years working in PDT, you have to do control experiments that use light alone. Okay, so PDT is the combination of light with a photosensitizing dye, but as a control, you omit the photosensitizing dye and just use the light. And what you find if you do that is the light alone does pretty much exactly the opposite of PDT. So instead of killing things and destroying tissue, it heals things and regenerates tissue. It does exactly the opposite. So you would not generally use light alone to treat cancer or infections, although to some degree you can, but by and large, you would use light alone to heal, regenerate, reduce pain, inflammation, and a lot of beneficial things. So having made that realization way back, I started to work in both, in PDT and in PBM for different applications. turns out that photobiomodulation has a lot more traction than PDT. So although, people still do PDT, there are still clinical trials, there are clinical applications of PDT. The medical applications of PBM are much more impressive and much wider, because PDT was, complicated. You needed the photosensitizer, the light was often the laser, and PDT is not something you can do at home, but PBM certainly is, especially, as I mentioned, because LEDs are now becoming much more widely available, much cheaper, and much safer than lasers. So that's how I got into it.
That's fantastic. So when on the photobiomodulation front, before we get into the history, which is unbelievably fascinating, when did you really realize that the potential applications for photobiomodulation were dramatic? It wasn't just something that maybe could be used on the side, but rather something that could be legitimately used in the medical community by physicians, other providers, and even people at home to have these dramatic benefits. When did you just kind of make that, maybe the eureka moment when maybe this is bigger than you had originally even thought?
And I think that really came about when it became clear that it was easy to use it at home. That was the thing. And as I said before, people are not going to put a lot of time, effort, and money into traveling to somebody's office to have a light shone on. I can shine the light myself. I just need to have the right light. That's all. And somebody to tell me roughly how often to use it, for how long, and so forth. I'm still, and as you said, PBM is not widely accepted by the medical community, probably because it's so simple, and also because the model of a pharmaceutical company getting a lot of money for drugs is difficult to apply to PBM. Because if you make a light device, you can sell it to doctors, but it's not going to be that expensive. It's not a repeated prescription like an expensive drug where you have a month's supply and then another month's supply. It's a single purchase of a device, and if it's an LED device, it's not going to cost a lot. So it's difficult for hospitals and doctors to really make money out of photobiomodulation.
Yeah, and I think it's a big problem now. I had obviously somebody you've worked with very closely on the show previously, Dr. Paolo Casano, and we really got into this specific topic, quite deeply, the frustration with the lack of funding, even that's coming from organizations like the NIH. And we discussed the fact that, even some of these grants that are, put in by Harvard itself, right, a preeminent institution in the world, sometimes can't get the funding to do these really large studies on PBM. And we discussed the frustration behind that. I understand why, physicians and other providers are very resistant to the idea that light therapy can have these massive benefits for all the reasons that you said. And there's other factors, obviously, that color, the way they think about it. But why would even governmental institutions, or let's say people that have the money, not want to invest? Because from a governmental standpoint, if you think about it, if PBM was used very widely, let's say in the United States or where you are, right, in Scotland or in the UK or wherever, just kind of in the West, the reduction potentially in the amount of people experiencing chronic conditions, it would be reduced, and we would save billions and billions of dollars, way more than what the NIH would spend on doing the funding. Why is there such a resistance, even from governmental bodies, to put the money into research on photobiomodulation?
Well, the reason for that is that all these, government and funding bodies are obsessed with the idea of evidence-based medicine. So in order for treatments to be approved, to get regulatory approval, they have to be shown in randomized, double-blind controlled trials to be effective. And it's quite easy to do that with PBM because it's highly effective, but who's going to pay for it? And normally these trials are paid for by the pharmaceutical companies that make the drugs, right? Now, as we just said, this doesn't apply for PBM. So the device companies that make the devices do not have the multi-millions, tens of millions needed to control large double-blind randomized trials. They just don't have that money. So since these trials are not being funded by companies, as you say, the NIH could fund them, and I guess it has funded some, but nowhere near the amount of money that's put into drug trials, nowhere near.
Yeah, and it's frustrating because, for somebody, I picked up utilizing PBM for my own patients, and then in the wellness about 2 years ago. Honestly, as I'm an orthopedic spine surgeon, so it's just not something that I was exposed to. No company or anybody in my entire career had ever approached me and say, "Hey, you're doing all this spine surgery, you're taking care of all these patients that have back pain and sciatica and all these other things." I never was approached one time ever. Okay, other than maybe some random email that wasn't even addressed to me, but I was never approached and say, "Hey, you should be looking at this for your patient population." My patient population just plain old has pain. I was never, approached by it. But so I've been in this, in the kind of the industry of photobiomodulation, not industry, but treating patients and clients through, our wellness centers. The results of photobiomodulation on people are nothing short of dramatic. I mean, I was skeptical, but then when we started treating people, and we use both kind of lower light LED kind of beds and things like that, but also high power lasers for more, more serious injuries, things like that, especially for people that have severe pain that you want to treat quickly. It's so easy. Literally the N of 4, 5, 6 in a row of the same thing, and you're seeing these dramatic results. So my frustration is I've been, involved in photobiomodulation now for 2 years. I see beyond results that are so dramatic that as a physician, I just, it's incredible. But and it's easy to do these studies if we just had the money to do it. You nailed it. It's easy. What can we do to kind of get money pouring into this space so we can do the studies?
Well, I don't think anybody has a clear answer to that. I mean, it's bedeviled the field for years. All you can do is, I'm sure podcasts like yours help. The more information that goes out there, the more people will start to order devices themselves, but also they will ask clinicians who are treating them, "What about photobiomodulation? Can't you do that?" So the more people that ask their physicians, I guess, then they will start looking into it, you would hope.
No, absolutely. No, it's interesting because, again, when I talk to my patients personally, because I have the knowledge behind photobiomodulation now, and obviously we've treated a lot of people, but also the research is there. There is enough, maybe there's not these massive large scale studies, but there is enough small studies. One came out of, your former institution at Harvard, for example, on concussion, that randomized controlled study from 2021. I have all this data now to give people. The people themselves are extremely open-minded to it, and they said, "Really? We can treat that with light?" They're open-minded. But the frustration, and something I've talked to Dr. Casano, I've talked to Dr. Scott Sigmund, the Ortho Laser CEO and well-known orthopedic surgeon, about how we, really promote photobiomodulation and do these things. And yeah, they feel the same. When we give patients these opportunities, to try photobiomodulation, they're more than open to it. The problem is that there's just a tiny, tiny handful of physicians that are willing to even open their minds to understand the power of photobiomodulation and how dramatic it is. I mean, if you think about Alzheimer's disease, Parkinson's, concussion, we could, soft tissue injury, on and on and on. And so one of the things that I've talked to those other, physicians about is what are their strategies to really talk to our colleagues and get them on our side, bring them to the light, so to speak. And I'll just tell you what Dr. Sigmund said. I love his analogy. He basically, when he sits down with other physicians, he tells them, hey, listen, do you believe in photosynthesis? And the doc said, yeah, I believe in photosynthesis. It's real. Well, think about photobiomodulation. That's also real. And then they at least are willing to think about how it works. And we'll get into the mechanism in a little bit. But, what would your advice be to those of us that are trying to spread the information to our colleagues because we're so passionate about it and we see like incredible changes in people? What are Dr. Hamlin's tricks? Because if I say, listen, this is what Dr. Hamlin says, they might listen because all they have to do is look you up and they'll say, yeah, he might know a thing or two about light therapy.
Well, a lot of people don't believe until they experience themselves. I mean, I guess since LED devices are so cheap now, you could get a few, flexible belts with a few watts of red, near infrared LED power in them. You can get for a couple $100 or something. I mean, if you had a big stack of these belts, you could hand them out to people and say, just try it,
Yeah, absolutely. There's all these, there's these helmet devices.
Helmets,
The helmet devices for, for dementia and things like that, I think are going to be, the wave of the future. I think it's going to be ubiquitous, even though there's some, we'll get into dementia a little bit later because I really want to pick your brain on that. That's such an important topic. And I also want to get into, what the differences are between, more high-powered lasers as far as penetrating the skull, versus lower level LED devices at penetrating the skull, and how, maybe there's more of a role for more acute things to use the more high-powered lasers and then more of a maintenance program with a low-level LED. But we'll get to that a little bit later when we talk about, dementia. I just want to go back, now and talk about the history of light therapy. I know you've written a lot. I have your, one of my favorite books. Honestly, I think I've used more highlighters and underline in your photobiomodulation of the brain book. It's great. There's so much highlighting in there. All the pages are crinkly, because it's just fascinating, that book, that you edited and have a lot of stuff in there. Can you tell us, just not the full version, we'd be here for 6 hours, but a version of photobiomodulation from the beginning? I mean, right, the Nobel Prize was won in 1903 for light therapy for, tuberculosis and things like that. But can you tell us kind of from the beginning? You can go way back as far as you'd like, to photobiomodulation and how it evolved over time and what were the critical milestones in photobiomodulation.
Yeah, I think you hit the first real critical milestone was Niels Svensson, who got the Nobel Prize in 1903. He had a huge arc lamp that produced basically 2 different kinds of light. Okay, there was a light that had some UV and blue and was called actinic light, and there was a light that had red and near infrared and was like a thermal light. So basically, there was 2 kinds of light you could use for treatment. It was the actual light was generated with a huge arc lamp with filters and telescopes and things to deliver it. But that really kicked off. And after that, a lot of people produced electric light baths. And I don't know if you've seen the pictures of them, but they were like things you climbed into with electric light bulbs all over them inside, because Edison had invented the electric light bulb. That was a big deal. And again, there were two different kinds. There was the actinic light and the thermal light, and the practitioners would choose which one was the best for different conditions. At the same time, we're talking 1910 and 1920s, at the same time, a lot of clinics opened in the Alps for heliotherapy, and hundreds of people exposing themselves to sunlight in high mountains. But again, a lot of different conditions, including wound healing and, psychiatric diseases, but there were infections and unusual things. And tuberculosis was a big deal in those days. So we've got the electric light bars and the heliotherapy. But the next milestone came when Ted Mayman developed the first laser in 1960, which was a big deal. And then Andre Mester in Hungary, he got one of the early lasers, and he was trying to cure a cancer because there was a report you could cure a cancer with shining a laser beam on it. But his laser wasn't sufficiently powerful to cure the cancer. You really needed a high power laser to sort of blast it. But he did notice that wound healing and hair regrowth, because he was using rats as models and to shave them, create a wound to implant the tumor, that wounds and hair regrowth were stimulated by this laser. And that got a lot of attention, and people thought there was something magic about laser beams. They thought because of the coherent monochromatic light, it did something magic. So they had temporarily forgotten all this business with electric light bars and heliotherapy. They had forgotten that just light can do this, right? They thought there was something magic about lasers. And that lasted for 20, 30 years, and laser therapists sprung up all over the place, and they all had their own different wavelength lasers, and it was a bit of an art to choose which laser to use on which kind of patient. And a lot of it was, sort of orthopedic type injuries, tendinitis, sprains, muscle aches, these sort of things, non-healing wounds, non-healing fractures, all these things. And people went to their laser therapist to get treatment. And they still do. I mean, laser therapy is still a big deal. But as I just said, the development of LEDs really allowed PBM to approach a mass market. At least hasn't yet, but we're hoping it will, because I can envisage the time when every household will have 1, 2, or even more LED devices. Put away on a shelf. If you need it, get it out. If you've got some kind of chronic condition, or you think you're at risk of developing a chronic condition, such as dementia or arthritis, all these chronic conditions, you may want to use your LED device every day.
Thanks for that. Let's talk about the ability for photobiomodulation to really make an impact when it comes to brain health in the future. Now, in your book, in one of the kind of the interests is this decline in the frontal lobe functioning over time as we age, and the possibility for photobiomodulation to increase blood flow, to improve mitochondrial function, all these other things, and improve cognitive function. I mean, I have a stack of papers here, right in front of me that talk about all of the exciting things going on, for example, in Alzheimer's research and other things where, targeting the brain, can help. Can you just talk about what kind of the long-term ramifications of transcranial photobiomodulation may be in us extending our ability, number one, to maintain normal cognitive function, but number two, to really start to treat people that are having early dementia or cognitive decline and reverse that, or at least put it on hold? Is this something that is going, do you envision this in 10 years, that it's so ubiquitous that it's just normal standard of care in the medical community, that not only are we using it to treat, but we're also using prophylactic photobiomodulation to the brain to prevent the development of these conditions?
Yeah, right, because the photobiomodulation can do so many different things in the brain. As you say, it's good for increasing cerebral blood flow. That's been shown many times. Another major thing it's very good at is reducing neuroinflammation. And neuroinflammation is characteristic of virtually all brain disorders. Even ones people don't think about, like psychiatric disorders, degenerative disorders, traumatic brain injuries, stroke. Virtually anything that goes wrong in your brain is characterized by enhanced inflammation, especially chronic inflammation. Oxidative stress is another big deal in the brain. So, whenever your diet's not very good, or your lifestyle's not very good, especially, overweight and all this thing, you have low levels of oxidative stress, right? And this is really one reason for all sorts of brain disorders. And if it's chronic, maintained over decades, it could contribute to neurodegenerative diseases. So inflammation, oxidative stress. Another thing photobiomodulation can do is prevent cells from dying. It's actually quite good at upregulating anti-apoptotic proteins. As you know, apoptosis is the mechanism by which cells die. And if you can prevent apoptosis to some degree, you will stop cells dying. And a lot of brain disorders are characterized by cell death in the brain. So there's also the opposite of that, which is the formation of new brain cells, which is called neurogenesis. And recently, neurogenesis has become accepted to be very important in the brain. A long time ago, people thought you couldn't grow any new brain cells. All the brain cells you were born with, well, that had to last you your whole life.
Yes.
This is clearly nonsense, because babies have little brains and adults have great big brains. So where did those cells come from, pray? But never mind. So the new brain cells are formed in a few select parts of the brain structure, and the hippocampus is specifically a certain part of the hippocampus. But a few other, they're called neurogenic niches. This is where new brain cells are formed. And it's been shown, especially in animal models, that PBM can trigger neurogenesis. It's hard to show this in humans, because you need to feed them various markers and then kill the humans and look at the brains. But we assume that because it works in mice and rats, that it also works in humans. But perhaps the most important thing that photobiomodulation can do in the brain is synaptogenesis. So synapses are the connections between existing neurons. Neurogenesis is the formation of new neurons, but synaptogenesis is the formation of new connections. And this is how people learn things. They form new synapses between some of your billions of neurons, and disturbances in synaptogenesis are behind a lot of psychiatric disorders. So people get things like hung up in their brains, right? Examples are things like autism, obsessive compulsive disorder, depression, anxiety. These wrong pathways get kind of stuck in their brains. It's also, synaptogenesis is very important after a brain injury or a stroke. You know, people talk about having to learn to walk again, learn to do things again, which means rewiring the pathways in their brain that have been disturbed. And photobiomodulation appears to be quite good at rewiring these synaptic pathways. You know, all the neurodegenerative diseases, Alzheimer's, Parkinson's, dementia, what have you, are characterized by poor synaptogenesis and lack of neurogenesis. So I call these two things helping the brain to repair itself. So although you have something wrong with your brain, you may have had a head injury or a stroke or chronic neurodegenerative disease, you can still help the brain to repair itself. If it's a chronic neurodegenerative disease, you're probably not going to cure it, like Alzheimer's. You're probably going to slow the decline. But if it's a stroke or a traumatic brain injury, you can pretty much cure it. So if you can get back to the level of function before the event that caused it.
It's absolutely fascinating. You know, I'll share a little, you know, I was going to get into Alzheimer's disease, but why don't we'll get back to that. Thank you. That was very, very interesting on the synaptogenesis and the formation of new brain cells. Just think of, let's just, for the audience, I just want you to hear, I'm going to repeat a little bit of what Dr. Hamblin said. If you shine a light on the brain with the right wavelength and right frequency, we didn't get into wavelengths and frequencies yet, but anyway, if you do that, then you can restore the function of the brain by regenerating the synapses, by potentially even regenerating nerve cells and rewiring, helping to rewire the brain back to its baseline functioning, for example, in concussion and things like that. And then you can slow the process and improve cognition in things like Alzheimer's disease and others. But I want to get into concussion. This is something I talked with Dr. Cassano quite a bit, but we have personal experience. So I'll just give experience. So one of our nurse practitioners who we hired actually at our spine and neurosurgery clinic had a horrible concussion. Was involved in an accident, and she had just been hired. I didn't really know her, but we were waiting for her to come back because we were very excited about her. And interestingly enough, her specialty is brain care, of all things. And she had this concussion. She could not get over it. She had treatment from all kinds of institutions and doctors and was not improving. And so finally, I intervened, despite the fact I didn't know her. We reached out and said, hey, why don't you come in to our clinics and start doing transcranial therapies, the whole body photobiomodulation, oxygen therapy. We did a whole host of things. Her level of recovery from where she started utilizing specifically, the biggest one is obviously the transcranial photobiomodulation, is nothing short of remarkable. And we've replicated that time after time after time. And so I love what you said in the concussion, model, that you can return to pre-concussion baseline. Now, not every time. I don't want to, oversell stuff. Not every time. However, the studies are very supportive of utilizing transcranial photobiomodulation in the post-concussed state. So can you talk about the more recent study that came out of Harvard, or anything, or any other studies you'd like to mention on the treatment of traumatic brain injury utilizing transcranial photobiomodulation, and really how powerful the results have been? Because this is real. Again, this is real science. I've had numerous conferences with neurologists and other people taking care of TBI, and I can tell you, trying to get them over the hump and thinking about photobiomodulation is very difficult in that setting because they've never heard of it. They weren't taught in medical school or whatever school they went to, but maybe hearing it, not just reading it, but hearing it from you directly may make a difference. So I can basically use your words in this, this upcoming, whatever you're going to say, to really say, listen, this is real. This is real hard data that has been widely studied.
Right. So, with things like traumatic brain injury and stroke, it's interesting to distinguish between the acute event and the chronic damage. So, if you have a stroke or you have a head injury, it would be a good idea to get light put on your head relatively quickly, within hours, maybe, or 24 hours, but relatively quickly. And that could have a big preventative effect because, as you know, the damage from a TBI or a stroke spreads in the days, maybe even weeks after the event. So it kind of spreads. The air, you can even image it with CT scans, the spreading of the area within the brain. And if you can get the light on the head, you can stop or slow down this spread. So that's acute. And as you know, the big trial for stroke with Neurotherapy that was conducted a few years ago with 1,000 people in was unsuccessful.
Yes.
And there's a few reasons why it was unsuccessful. Probably because it was a single treatment with this laser they had in various areas over the head. So, but the first two trials they did were successful. It was only the big third trial that failed. So it wasn't as if the whole idea was ridiculous and never should have happened. The first two trials were successful. They just failed to design it in such a way that the final trial was, which is a shame. Now, for chronic TBI and stroke, I think it's underexplored because, especially for stroke, there are stroke rehabilitation clinics all over the world. And as far as I know, very few of them use any transcranial photobiomodulation. It's all, exercise and repeating, which is good. You need to do that.
Yes.
But because the PBM can shuffle around the synaptic pathways in the brain, it can help it dramatically. And with chronic TBI, which is a lot more cognitive than motor impairments, again, the evidence on chronic TBI and PBM is encouraging. But I mean, if you're involved with chronic TBI clinics, then I guess it's not used much that people don't realize. In addition to PBM, there's a whole bundle of other non-invasive brain stimulation techniques. Yes. Transcranial magnetic stimulation, transcranial direct current, transcranial low-intensity ultrasound, which all do similar things. Yes. So this idea of using non-invasive brain stimulation has clearly got legs. And people have not tried to combine PBM with any of these things. You would expect that PBM could be combined with other things. Everybody's got their own sort of hobby horse in this field. It's difficult to encourage them to investigate combinations, but none of the drugs that have really been proposed for treating the brain are very good at all. And it's even with psychiatric drugs, antidepressant, anti-anxiety, and they're multi-billion-dollar markets, and they don't work very well at all. Whereas transcranial photobiomodulation seems to work pretty well for depression and anxiety and insomnia. Insomnia is a big deal. Rather than taking a sleeping pill that's going to knock you out, put an LED hat on your head before you go to sleep. Yes. You go off like a baby.
Yeah, I definitely like to do photobiomodulation before I go to sleep sometimes on certain settings. It works. I mean, it really is pretty amazing. I want to go back to the TBI issue for a second before we get into some of the more, other things, especially like Alzheimer's and Parkinson's. In the TBI, in the study that was published out of Harvard in 21, which really because when that was just before I started doing research on PBM just in general, and that study was really impressive to me in the fact that it was randomized controlled, and they showed, for the first time, actually in a bigger study, I believe there were 68 patients or something like that, and there was a sham side, and then there was the side with that helmet that they had developed there at Harvard. But it clearly showed, not just from a functional standpoint, right, from a recovery standpoint clinically, but it correlated that with significant changes on MRI scans, which is really something that we need. We need more of that hardcore science to show that. But interestingly enough, when, for example, like we have treated some physicians, their parents that have Alzheimer's or TBI, things like that. When I show them that study, a very well done study, they're much, much more inclined to say, wow, this has some really good data on it. Maybe, we can look at that. So what do you, I mean, do you think that study should be replicated at a bigger level? That's one that funding, because listen, at the level 1 trauma center where we cover, all the trauma, we see TBIs. I mean, we see 10 to 20 TBIs a week at the hospital, just from, they'll have little tiny bleeds or something like that, but they're clearly concussed. Should that study be replicated on a much larger scale, and then maybe we can accept it globally and say, this is the treatment for TBI?
Yeah, I mean, acute TBI, that study, Mass General, was a nightmare to actually organ the head injury. And it turns out that there's like a whole battery of trials competing for these patients, right? To see the US. So there were all these trials trying to sort of seize on these patients. It was like, survival of the fittest to get them into the trial, which is why the whole thing took years and years to organize. Which is a completely different from something like Alzheimer's, right? I mean, there are literally millions of Alzheimer's patients, especially in care homes, who are just sat there. It would be dead easy to get LED helmets to these patients. It would be dead easy. They're all sat there in care homes. They're not going anywhere. Nobody's doing anything with them.
You bring up a great point on it. For these Alzheimer's patients, one of the things that our group is doing is actually we are meeting now with memory care facilities and discussing the fact that you've got these patients here. I mean, they're residents, but we'll call them patients. As a physician, I put my physician hat on. They're patients. They're people that whatever. And you nailed it. That's the beauty of it. They're sitting there anyway. Why are we not doing something more active? Now, I'm a big proponent of a multi-pronged, non-invasive approach for these people. You combine that with pulsed electromagnetic frequency therapy and, some oxygen therapy and structured, all these other things that have been shown to reduce neuroinflammation. Again, you're right. There are millions of these people sitting there. Why is this not a massive initiative, right? If I had a parent that had Alzheimer's disease or an aunt or whatever, and they were going into one of these facilities, why would we not want to actively do something to help them to extend their ability to remember people, to do cognitive tasks, to do that, instead of just sitting there and pushing them around in a wheelchair or trying to make sure they're not escaping?
Yeah, I mean, I talked to one or two people who had a relative in a care home with Alzheimer's, and they wanted to take in a near-infrared helmet, but I guess the medical physician or the nurses, but somebody said they weren't allowed to do it. No, we're not having it in here. You can't do it.
Really? That's
Yeah.
interesting because there's no, I mean, there's really for those, class one, I mean, just for the audience, the LED helmets, they're class ones. And so they
Yeah,
have zero side
absolutely. Yeah.
effects. There's literally no, in fact, when it comes to photobiomodulation, right, the official, statement, even coming out of the FDA is it's clinically insignificant risk of
Yeah.
photobiomodulation. So it's safe. So the question is, why is this not being promoted? And that's why I'm making it, even though, listen, I'm a spine surgeon. People are like, how in the world did you get into this photobiomodulation? Like, why are you this crazed doctor going around, preaching because the potential for something that has such negligible risk to make dramatic changes in the world is off the charts, but yet no one is screaming loud enough, apparently, for people to listen.
As we said earlier, the general public doesn't really understand photobiomodulation. And if you come up with a helmet, it looks like some high-tech thing, and people, they're obviously afraid of something going wrong and there being some sort of lawsuit, but they don't really understand it. But as you say, these are demonstrably safe. It's a matter of, I suppose, keep banging on at these people until they start to believe you. I don't think there's a simple way of convincing them.
Oh yeah, I mean, honestly, and then I was just like, it's one of these things that I didn't even know about photobiomodulation 2 years ago. And as a physician who now utilizes it for a wide variety of conditions, and again, I just want to caution everyone, what we talk about on this is not a substitute for medical advice. So please go speak to your physicians if you need it. But personally, I could talk about my personal experience with it. It is only taken a couple years to get me to the point where I can see so clearly that the benefits of photobiomodulation are so powerful with such low side effect and risk profile that the fact that we are not using this across the population for a population that has become so ill with chronic diseases, and especially brain health is so important. It's so on the radar right now of people, especially as the baby boomers are getting older. Everyone's like, oh my God, I'm losing my cognitive abilities. Why? It is so clear to me, it's crystal clear that this is something that a major push. So I'm going to dedicate a lot of the rest of my career to pushing ideas like this, because it could not be more critical for our societies to adopt photobiomodulation as a way to, a preventative, but also a way to slow down, some of these diseases. So I mean, and I know your passion for it, and people can see that. They should go buy your. I mean, when I first ordered your textbook on Amazon, it came. I didn't realize how big it was. I mean, the brain photobiomodulation book is like this big. I mean, I wish I had it on. I normally have it on my desk, but I was reading it downstairs in the living room here. But anyway, I mean, obviously you're passionate about it, and there's other passionate people. I mentioned Casano and I mentioned Sigmund, and there's a lot. There's dozens and dozens of other people that are doing great work. Let's go back to Alzheimer's though for a second, because I know that you're very passionate about it, and like you said, there's millions of people out there. Generally, the studies, and again, this stack I have here, these are just studies on also, and this is just stuff I'm casually reading because I'm just so into this stuff. The studies out there clearly show that even after a couple of weeks of treatment, I'm talking 6, 7, 8 weeks, the improvement in cognition is very significant. How does, number one, what do you think about the studies? I know you're saying they're obviously very positive, but can you explain to our audience, specifically in Alzheimer's disease, what do you think, what is the mechanism specifically in Alzheimer's disease? We're going to get to Parkinson's next, but in Alzheimer's disease, how does photobiomodulation slow down the process of cognitive decline?
Well, so slow down the decline would be by increasing blood flow, reducing inflammation, and reducing oxidative stress, and preventing cells from dying. That's how it slows the decline. Now, as I said previously, not only can it slow the decline, it can at least partly help the brain to repair itself. because, I think that the idea of the brain being able to repair itself is going to catch on, right? So slowing the decline is clearly important, but helping the brain to repair itself may be even more important.
Yeah, and so in these Alzheimer's, in these smaller trials, I mean, this one, I'm looking at, was a randomized trial, but a lot of them are smaller, smaller sample sizes, but very positive, on it. One of the things in that book again was just talking about the normal process of aging and how, we have a cognitive decline and the ability for the brain to repair itself. If that is actually what is happening, and you're getting synaptogenesis and other things, and obviously in other primates that's been shown, and it can be translated into the humans. Again, we can't do the treatments and then section people's we're not going to do that as part of a randomized trial. I don't think that's a great idea. However, it is like I'm 50. I just turned 50 years old, and I do transcranial, photobiomodulation all the time. Why? Because I want to keep as sharp as I can. I actually do it before I do surgery. My surgery days now, and it makes a difference. And I know it makes a difference. I'm sharp. I could not be more focused and sharp doing it. Again, I kind of asked you this before, but in these other trials that are being done, and some are being done actually at your at Harvard, in patients that are considered normal, that they don't have it. People need to understand that their cognitive abilities can actually improve. You just doing transcranial photo. Could you talk a little bit about the improvement in cognitive abilities with shining the light through the skull?
You've probably heard people say that humans only use, I don't know, 10 or 20% of their actual brain to do cognitive functioning at any one time. So there's a lot of the brain reserve that's just sitting there. And, people who've had horrific brain injuries, like half of their brain is missing, still kind of function as humans. They still can talk and kind of do things, So I think that if the light therapy can encourage the unused part of the brain to function in a cognitive manner, this might help dramatically. In terms of healthy volunteers, there have been studies that have shown increases in various things. Not terribly impressive, I must say. Short, various memory things and reaction times and this sort of thing. So they have shown benefits. I doubt that PBM is going to have a huge effect on a perfectly normal, healthy person. It may have some. It's more likely to prevent declines. And if somebody has brain damage for one reason or another, it could have a dramatic effect in allowing the brain to heal and regenerate.
I think the potential from a medical standpoint is incredible. And I think photomedicine, another one of, your book, like the photomedicine in general, I see these clinics of the future of medicine involving a lot of non-invasive, non-operative modalities, including vibrational things that are being worked on and sound therapies and all these things. And you're right. What you said before is what our clinics are interested in and want to do, research down the road in. Again, it's a money issue as far as doing the research, is combining the therapies. So, for example, I've become good friends with Dr. Kirti Sunder, who is really a world expert on transcranial electromagnetic stimulation. So we want to develop a study in combining transcranial electromagnetic stimulation with photobiomodulation over a period of, let's say, 6 weeks, 8 weeks, 3 months, whatever it might be, and then comparing it to those two things alone and seeing the additive benefits of those two things in models of, like, for example, concussion or resistant depression or severe anxiety, those types of things where transcranial electromagnetic stimulation, which is FDA approved and paid for actually by insurance companies. If we combine those two things, science, just a scientific brains would say that that is going to be even more powerful than PBM or transcranial electromagnetic stimulation alone. But we see the clinics of the future absolutely, being these combinations, especially when it comes to brain health. It's literally a no-brainer, no pun intended, but to utilize all these different modalities to really actively restore brain function and brain health. And it's so far away from the minds of the way that neurologists are currently treating brain health right now. I mean, they're really not. Some of them are doing like transcranial electromagnetic stimulation, but again, it's very far. Photobiomodulation, I don't know one in my area that's actually having it as part of their practice or referring out. So we are trying to work with them and do partnerships to do that, for them. And so I think this combination idea in the future is really what's going to stimulate a lot of energy and buzz, because I think that's going to show more and more positive, recovery. And then one I didn't even ask you about, what I'd like to ask you about right now, because I want to get into Parkinson's in a minute. Post-traumatic stress disorder, so important, so on the radar. Like, for example, the U.S. government right now on post-traumatic stress disorder, I was actually at D.C. About 4 weeks ago lobbying for light and laser therapy to be used more ubiquitously in this country. And actually was received very positively, but there was a lot of U.S. government people there talking about how big their initiatives are in PTSD. But one of the things that is not on their radar for PTSD is utilizing light and laser therapies to help in PTSD. What are your thoughts on utilizing it for post-traumatic stress disorder in your experience?
There's been one or two sort of case reports of PBM used for PTSD. So it's like all these things where synaptogenesis is a big deal. So like drug addiction, right? Fred Schiffer has got a grant to treat drug addiction with photobiomodulation, and he's getting good results there. Autism, that's another example. ADHD, these seem to respond to transcranial photobiomodulation. One area that nobody to my knowledge has tried is eating disorders. That's clearly where synaptogenesis plays a huge deal, because these folks get this fixed in their head that they can't eat or whatever, and they die. I mean, they die of starvation. Photobiomodulation could be expected to make a benefit in eating disorders and obsessive compulsive disorder, all these things where people get trapped in the wrong brain pathways.
Yeah, absolutely. I mean, there are such a litany of conditions that can benefit. And again, for the audience, my question just for the world, right? And I think you answered this before, because there's other forces at play and what actually makes a lot of money and things like that, is the fact that we can potentially use these modalities to help so many millions of people struggling with so many different conditions from something as opposed to a drug which has massive potential side effects. We're using things that have almost no side effects, especially if you're using it like on the class 1 level, right? I mean, the more power you go up, that there could be more side effects with that. But from utilizing it at an LED level, it is a no-brainer beyond a no-brainer. Do you feel like we talked about it before about pharmaceutical companies and them being able to pay for this and things like that? Do you feel like there are forces that are outside, and I don't mean to get into this, it's not more about conspiracy theories, it's just more about like the truth. Do you feel that big industry in general, I'm not going to name names, but big industry in general almost is purposely trying to maybe misdirect, like maybe kind of poo-poo or minimize how important something like photobiomodulation can be in the general treatment of patients, because obviously it's going to reduce profits. If people are healthier and they have less of these diseases, there's less profit to be made somewhere else.
Yeah, I mean, you mentioned sort of power. So there's a big difference between lasers and LEDs in terms of what people think about power, right? But it's wrong. So if you had a 20-watt laser, you would consider that a class 4 high power laser, right? If you have 20 watts of LEDs, that's nothing. You can have that in a belt or a helmet. 20 watts is just nothing in the grand scheme of things. I mean, you think what you get if you go sunbathing, right? If you go sunbathing, you say you went on the equator and you slathered yourself in SPF 50 so you didn't get any sunburn. If you lay in the sun for like an hour at midday, do you know how many joules of energy you'd absorb? Have a guess?
No,
1 million joules of energy.
I didn't. I mean, I've never heard that before. That's amazing.
Yeah. So total energy is a big deal. And with these whole body light beds, you can absorb 100,000 joules of energy relatively at 20 minutes, sometimes, something like that. 50 to 100,000 joules of energy. And you need, certainly sort of chronic systemic conditions, you need a lot of energy. But with LEDs, you can do it. You don't even get that hot. A little fan maybe will keep you cool, but you don't get that hot. And then people worry about high power lasers. There's nothing against high power lasers, especially for orthopedic things where you say, I get right down to a hip or a shoulder or something. That's fine. That's probably the best thing is a high power laser. But for a lot of conditions, LEDs can pump a lot of light energy into the body. And nobody really knows if there's an upper limit. Because this is actually said we're not doing any thermal damage. You might get a little warm, but you're not going to get any burns or anything. Nobody really knows if there's too much light energy. Probably not. But if you think 50,000 or 100,000 joules of energy on your body is something to aim at. On your head, you probably want to aim for 3,000 to 5,000 joules of energy per session, something like that. Which these helmets can, so suppose you had a 10-watt helmet, right? So that is 10 joules every second, or 600 joules a minute, 6,000 joules in 10 minutes. So if you had a 10-watt helmet for 10 minutes, that's 6,000 joules, which is a decent dose on the head.
Yeah, you bring up a great point. So the way, and I'm going to get to the late, because I want to talk about the skull and the penetration of you talk about the 6,000 joules. So I want to compare. It's more of a, honestly, it's more of a question for me as we kind of figure out what the ideal dose is for the brain. And that was wonderful. But kind of what we do is you nailed it. So we, in our clinic, in our wellness centers, we do, medical grade, high power photobiomodulation in short periods of time, trying to deliver big doses. And it's working wonderfully in people that have fatigue and chronic disease. And we've got people that have, all kinds of things, multiple sclerosis, and they've got rheumatoid arthritis and things. It's incredible for pain, fatigue, all these different things in the whole body. But you're absolutely right for ortho. So for example, for neck pain, for our joints, for deep shoulder stuff, or low back pain, or whatever it might be, or even knees. Knees are a little bit more superficial, but we use the high powered lasers because they kind of give more instantaneous results. And the higher, what we're finding is the higher the power that we use, the more they walk. And obviously you have to be careful because that does heat up the skin, right? So we're very careful, and we have this whole protocol, but the patients will leave with a dramatic reduction in their pain if you do it high power. We know if we do low level laser, treatment, or we do it over 5 or 6 sessions, they'll see significant benefit. But when you do the really high powered stuff, literally some people walk in with 9 out of 10 pain in their low back and walk out with a 2, and that might last them 3 or 4 days of that kind of pain relief just from one session. And so I think splitting out like what conditions you treat with what power is something we are working on like incessantly and developing protocols, because again, I don't have a manual I can look at and say, okay, for this thing we do this. We're literally inventing it with experience and the N. As our power goes up, as the number of patients goes up, 100 every week, 200 every week, we have more and more people to then build those specific protocols. So I love what you said.
Yeah, I think with pain, there's a neuropathic effect of a high power laser. So you stop the pain signals going along the nerve. So in addition to reducing inflammation in the lesion, you're blocking the pain signals. And an LED panel or a belt probably is not going to do that. It'll work fine for reducing inflammation, encouraging healing. But as you say, you need to use it every day for probably a while. Whereas a high power laser may be able to block the pain signals right there and then.
Yeah, absolutely. And one of the things we have done, and this is something I really want to bring attention to nationally, because it's really not done, is we've been able to partner with some physical therapists now. And I could tell you it was hard. It was hard to do, because obviously the worry is if you are saying that with a high powered laser, we can reduce somebody's pain almost instantaneously, which we see that day in and day out, then physical therapists might worry, hey, I'm not going to refer my clients over there because if their pain goes away, they're not going to come back. But what we've done is we've partnered with physical therapy groups and said, listen, what we do is reduce their pain, because some, like for example, my patients that have spine problems, some of them I've just met for the first time. They can hardly walk into the clinic. They are in severe pain. If I send them to therapy and they're using a walker because they could hardly move, what is the therapist going to do? Have them take 3 steps and discharge? There's nothing to do. But if we treat them with the high-powered laser, then when they go to the therapist, if their pain is now down to a 3, think about how much more strengthening they can do. So we're really trying to get this message out, because we believe this should be the model nationally. And how you treat, you do a combination of laser treatment with physical recovery, and then you get the optimal protocol. Because my patients come back to me and they always say, hey, you sent me to therapy. I couldn't even complete 1 session. I can't move. What am I supposed to do? So this combination is really giving us this powerful tool of decreasing pain and increasing mobility, simultaneously. I think it's a powerful, powerful tool. I can't get this message across, though, on a wider basis.
Well, you should probably treat them in your office with the high power laser, but give them an LED device to take home with them, a sort of flexible belt or something that will go around whatever they have. That's what I would do.
Yeah, to give them more, to just continue the treatment even when they're out of the office. Again, they're not going to get the same effects.
I think you've raised an interesting point that there may be some of these therapists who want to keep encouraging people to coming back for more and more. I mean, I don't know. You would hope not. You never know.
Yeah, no, I mean, I love therapy. I mean, I use them. I need them. I mean, therapists are like my best friend when it comes to being a spine surgeon, right? They recover my patients, we strengthen them, we do stuff. But just this understand, and that goes true for multiple, because I think in the medical community, there is always a fear that this next thing, whatever the next thing is going to come around, and all of a sudden your office is going to be empty because the patients are getting pain. Same thing with pain management specialists, right? If we're reducing pain dramatically with PBM, all of a sudden maybe they don't need to go in and get those drugs or those procedures done because they don't have pain. So what are they going to have that for? And so it's an interesting, we need to find a good balance to how can we all work together really to improve patients' pain. I mean, pain is such a big category, right, to treat.
Well, you would think that pain management clinics would take up photobiomodulation. Unless you're really saying that the big pharmaceutical companies are kind of, preventing them from doing what's best for their patients. You would hope not, but you never know with all this OxyContin scandal and this palaver. I mean, you never know about these people.
Yeah, I don't put anything past anybody. But again, my role is to try. I'm trying to really decrease people's objection to photobiomodulation as being something which should just be a normal part of wellness care, but very much a part of medical treatments for such a wide variety, of conditions. Because I will say, for the first thing, I'm upset that I was so ignorant and not and didn't know anything as a physician about photobiomodulation. I wish I had this as a tool, going back in my whole 19-year career at the beginning, because I think I could have helped so many thousands of people that I saw personally. But now my target is millions of people throughout the world, and bringing your message of photobiomodulation and everything, you've accomplished in your career. We can't just let this stay silent. People need to know the things that that have been out there. But again, it's not because of you. I mean, you've had it, like, your career is beyond brilliant. But again, if it's in a field that is so little known about, then some of this stuff goes on, on deaf ears. They just don't know about it. But I did want to go back briefly, because we could talk about, conspiracies and why this stuff, because I'm baffled why photobiomodulation is not everywhere. I can't even explain. I can't explain it. I don't have a good reason. But just going back to the brain, in that study. And like you said so well before, how hard it was to do at a Harvard. It's just because we're competing with so many other potential study. People want to study whatever, right?
Yep.
And especially medications. They want to study all these medicines that big pharma that can promote. Going back in that study, one of the parts of that was so interesting to me was the percent of light that gets through the skull. And in there, when they did that, it was 3%, right, of the light gets to the skull. So what do you think the difference is in percentage of penetration of the skull? Because this study's never been done, between utilizing LED and maybe a higher powered laser, let's say at 15 watts or 20 watts. Utilizing a laser, what do you think would be the difference in the skull penetration? And do you think that we would see dramatically different results potentially by using the more high power? Because frankly, we use, more of a high power laser to do the transcranial photobiomodulation. We took some other protocols that have been done here in the US in the NFL and some other things. And we see like really quick results. Like, people leave and they feel a difference immediately. So what do you think is the difference between the amount of light that penetrates and how many joules maybe you would get to the meninges between the two methodologies?
You raise a really important point that the field is still undecided on, and that is, to what extent is the photons that go through the skull into the cortex of the brain, are they the important photons, or is it other photons that get absorbed in the blood flowing in the scalp or the bone marrow in the skull? I mean, the photons have to go through quite a lot of tissue to even get to the brain. And, remote photobiomodulation is starting to be talked about. It's been shown to work in animal models. So you put the light on the back or the belly of a rat and it helps their brain if they have some brain condition. It works. It's been tried in humans. Quite often it's on the belly, because they say, oh, it's the gut-brain axis, but
Yes.
I'm not sure about that. And you think about Vialight, that delivers relatively small amounts of light to certain parts of the head. It's really unclear how important the photons that go through the skull and into the brain actually are. Because you see changes in the hippocampus, right? And you can be fairly sure that virtually zero photons reach the hippocampus. I mean, it's just not going to happen. The photons are probably going to all end up in the first few millimeters of the cortex. My gut feeling is that penetration into the brain, although it's probably important, is not the whole story by any means. There's an important systemic effect. in which case, you could recommend a whole body light bed as being the best treatment for the brain. So I think this will go on. This question is not going to be settled anytime soon. Obviously people think if I've got something wrong with my brain, I need a helmet over the head, and that's fine because you can have an LED helmet, you can walk around with it, you can do other things. If you use a class 4 laser on the head, provided you don't burn the scalp, it'll work for sure. Lots of people have shown that, but I don't think you need it. I really don't.
Yeah, I mean, I think it's really interesting, and I think that we really need to study the differences head to head, because I could just tell you our own experiences when I've seen is treating like the frontal lobe, for example. Like we do a lot of this frontal treatment with class 4 laser therapy. I'll tell you, and there are so many people that walk away, even people that are cognitively normal, that walk away and feel like a lot of people will say with specifically with the class 4 laser, as opposed to getting in the beds, because they do not have this experience with the beds. But if you do a 6-minute treatment on the head, is focusing mostly on the frontal lobe, they feel a level of energy. Some of them report there's like, I've never felt like that in my, like everything looks clearer, everything is better. This is after just a 6-minute treatment. And I know this is anecdotal stuff. Again, this is not medical advice, but even our concussion patients, they'll come in, they have that fuzzy feeling and things like that. And after just a 6-minute session of the class 4 laser, to the head. And again, we do much lower doses than we do for the body, like to penetrate a shoulder or things like that. They'll notice immediately, some of them, that they feel completely different in just the 6-minute. So what do you think is happening there? Why is that happening?
I think you need to get to a sort of threshold of power to feel this effect. And I felt this effect with a LED helmet with, I don't know, 15 watts of LED power. If you just use sort of 5 watts, you don't generally feel anything. And I would describe it as a feeling of like mild euphoria and maybe some extra clarity of thinking, maybe, but you just generally feel good, basically. And it's, as you say, it's relatively rapid within minutes of putting a helmet on your head.
Yes.
But you do need sufficient power to get to a threshold. A class 4 laser would undoubtedly do it. So I'm not surprised to hear that. Whether it varies depending on where on the head you put the light, because for the class 4 laser, you've got to aim at something. With a helmet, you put it over your whole head. So are you saying you're more likely to get this at the front, on the forehead, or?
Yeah, so we do the frontal lobe and then just kind of work our way back, but most of it is on the frontal lobe, because that seems to give them the most interesting, kind of feelings of euphoria and feeling good. When we do migraine treatment, which we haven't even for migraines, some people, I have seen people come in with 9 out of 10 migraines and walk out with almost no headache. So we do the head, the full head. We do 6 points. So we do the here, and then the occipital lobe. Okay. And then we do the neck for migraines. And in a 6 to 10 minute treatments, we've had people almost shut off the complete migraine, shut off. And then they come for their migraine. So we almost want to look at doing a larger migraine study where at some point in the future, class 4 laser therapy is actually used in the more kind of urgent setting. Listen, think about how many people that have migraines their whole life go to urgent care when they have a really bad migraine, right? Because they want to get a shot of Toradol or they want to get whatever. Imagine just treating it with a class 4 laser therapy instead of doing that. Do you know the level of savings to the system just in migraine care or headaches? It's incredible.
I haven't come across a lot of people working in migraines, actually. I mean, I've heard of photobiomodulation helping migraines, but I didn't know it was that big a deal. That
we're super excited about the, the treatment and migraines. And yeah, that's not something I know I know that's not something, you've looked at much, but there is stuff out there. Migraines, actually, interestingly, on the migraine topic, and you might find this super fascinating, and I don't know what your work is on this, but the University of Arizona looked at a study utilizing green light photobiomodulation for migraines and fibromyalgia, and they found very positive results. And they just got a big grant in green light, which works obviously very different than the red light and near infrared that are more focused on. But they just got a big grant to study green light therapy in the post-operative period to decrease pain, and then hopefully decrease the use for narcotics and things like that. What is your take, while we're talking about it, what's your take on green light therapy and how that can be utilized? Because, it's absorbed in oxyhemoglobin and hemoglobin and can release natural endorphins and things like that. Is a totally different mechanism.
Yeah, I mean, green light it may well be something to do with hemoglobin. I'm not convinced about that, but never mind. Green light is absorbed by transient receptor potential ion channels, which also absorb in the longer near infrared at 980, but are not major absorbers for red light. So if you want to target TRP ion channels, which is a big deal in pain, but they're also involved even in the mitochondria. I mean, it's not cytochrome C oxidase, but it's another mitochondrial chromophore, TRP ion channels. So if people are using green light for pain, I would suggest that the ion channels are probably playing a role in this.
Yeah. So one of the things and I'm just curious to hear your thoughts, is what we're doing in our pain protocol. Like, say somebody just has chronic pain. So what we are doing in our wellness centers is we are targeting the area of pain. Like, look, for example, let's say they have RSD to the leg because they had some horrible fracture, years ago, and then they ended up having RSD, but they still hurts their ankle where they had the fracture and they had major surgery and things like that. So we'll target the direct area of pain with class 4 laser therapy. We target their spinal cord area where the nerves are coming. So let's say they have more of an L5, like it's like correlates to the L4 and L5 dermatomes. We'll target that in the spinal cord. We will do transcranial photobiomodulation to just try to target, to try to decrease neuroinflammation in the brain and help the pain pathways to heal and get better. And we're using green light beds to try to target their pain through that mechanism. So, but utilizing that combination, we feel is going to be revolutionary in decreasing their need for narcotic uses and pain management, and just overall improve their quality of life. What do you think about that combination, that 4-pillar approach to pain?
I mean, I think centrally sensitized pain is mainly in the brain and the spinal cord.
Yes.
The periphery is where you feel it, but it's the brain that's.
Yes.
And so synaptogenesis should be helpful to kind of get this abnormal pathway back to normal. I would guess. I think that certainly on the brain is important, and I mean clearly the spinal cord, because the pain signals that go all the way up there. I mean, nobody really knows yet if green light affects the brain. I mean, it doesn't penetrate into it. If you put it on the head, it does not go into the brain at all.
Correct. So yeah, we don't do that.
So green light will go into the skin, and there's TRP channels in the skin. I mean, it'll go into the eyes, and nobody really much studies PBM light going in the eyes.
Correct.
But psychiatrists do. Psychiatrists use bright light therapy, blue or white light, sort of face things. You shine it in your face, it goes into your eyes, and it's absorbed by receptors in the retina, which are not visual receptors. It's the non-visual retinal receptors. And maybe do they wear goggles in these green light beds?
Yeah, we absolutely. So in the green light beds, absolutely. We have them wearing goggles as a precaution because we don't know a lot about it yet, but I don't. For example, so I just say that I don't because
Oh,
I want to absorb the green light in the photoreceptors, like personally, because my understanding is the photoreceptors in the green light, we just want, more, get a lot more information before, as we develop our protocols. But I do it all the time. I do green light, but my understanding is that the photoreceptors in the eye, like you said, the non-visual photoreceptors then stimulate a part of the brain to release natural endorphins. And that's why people also report a euphoria when they come out of the green light beds, potentially. But even if you're with your eyes closed, if you don't work, if you just keep your eyes closed in there, it's still going to penetrate the skin and will get in your eye some. And so maybe that is one of the mechanisms. And I've seen that reported as the purported mechanism of why it's so effective for pain, perhaps.
So, I see no reason why they should wear goggles with its green light. Blue light can damage the
Of course.
retina, chronic blue light at high doses, but green light and red light can't. So, and they're using photobiomodulation to treat retinal disorders, dry
True.
AMD and various things. So they're shining red, near infrared, and yellow light directly into the eyes to help them. And you can't damage the eye with red, near infrared, or even green light from an LED. And, if it's a focused laser beam, you can burn the retina.
Yes, yes.
But, with non-focused LED light, you can't do any damage. Blue, you could, but not other colors.
Yeah, one of the reasons that,
Dazzling, red light's good at dazzling you, but wears off
yeah.
in no. I mean,
Yeah, so for the red light, when we had them in the red light, we just weren't, we were, looking for more studies and things to come out, but that's actually very comforting. And the green, I do it all the time. My eyesight's perfect. I look at the green specifically because of the things I've read about that effect. But it's thank you for talking about the green, because there's like a couple things out there that like green is the new red and this and that, but we really have to figure out. One of the things I was going to ask you about the beds themselves is one of the things that we're very careful with is making sure if people have not had a history, even with the reds, of seizures before, because as you know, we have the strobe effect in the beds depending on what frequency you're hitting them with. That potentially you can stimulate a seizure. So if anybody has a history, then we do the blackout goggles, because they can't look at the strobe effect could potentially stimulate something. What are your thoughts on that?
I actually wrote an editorial about photobiomodulation epilepsy and addressed this issue of people are worried that pulsed light could trigger a seizure, and there's only a specific kind of epilepsy that this happens, which is the less common kind. It's not a common kind.
Okay.
So the idea is you can treat epilepsy with transcranial photobiomodulation, because like other kinds of brain damage, you want to encourage the brain to repair itself and stop it degenerating further. If you're worried about pulse light triggering seizures, then as you say, you put goggles on, but the light's going in the head. It's not going to
Yes.
trigger a seizure with this photosensor. I don't know what they call it. It's a special kind of epilepsy. It's not the general kind.
Okay. No, that's great information. Yeah, we don't worry about it much. As you can imagine, when you're running clinics, you want to make sure that you have a zero event, never events. And so until it's more clear, but obviously if you read an editorial on this and whatever, I'm going to look that up. I'd love to see that, because we always use that as one of our questionnaires, in addition to if they're on any photosensitive medications, we have to just make sure on that and things like that. Interestingly enough, what you talked about before, one of the things that I'm trying to get my neurosurgical colleagues to wrap their mind around is I'm convinced that in the post-surgical period, like for example, if you are removing a brain tumor, that transcranial photobiomodulation should be used immediately after that to decrease, because you're going to get swelling of the brain in the area of the surgical bed. And so why are we not using this?
Used during the surgery. Yeah, I've said this several times. You've got fairly intense white lights in an operating room, right? You should put near infrared wavelengths, say 850 nanometers, which are totally invisible in these lights. So you should, into the surgical cavity, you should be shining white light to enable the surgeon to see what he's doing, plus at least as intense 850 nanometer light to do photobiomodulation in the surgical cavity. I mean, why not? Why not re-engineer operating room lights?
That's an absolutely brilliant idea. I mean, I think that we need to talk about that a little bit further. I mean, that's incredible. You know, what's interesting is that there are orthopedic surgeons now that are using near infrared light before they close the skin, shining the light on that area, and it is being done. And again, there are people that I know, I don't, you know, that they're just kind of doing it off label, right? We haven't done that yet, but we want to do a study. We've actually talked to a couple surgery centers about doing this study, but those surgeons are reporting that the wound healing is so dramatically faster if you treat them with near infrared light right before, even before you close the skin, and then you continue the treatments afterwards. It's dramatic for wound healing. So again, why are we not using this, ubiquitously in trying to help patients? Not to mention that the faster the wound heals, the more you reduce that inflammatory response, you're decreasing potentially the risk of infection. No one studied this on a large scale.
As you probably know, people have shone red near infrared light on the skin and then subjected it to ultraviolet. So preconditioning the skin with red near infrared dramatically reduces the damage caused by ultraviolet. So in principle, you could use the same approach in surgery. You could put red near infrared light on the skin before any incision to precondition the wound healing.
Absolutely. And this is something we talked about. We're actually, at this time, we are developing specific, not intraoperative yet, because that I want to do in conjunction and maybe do like, an RB institutional thing. However, preconditioning patients, I am, starting, we are putting together protocols to precondition them with light before they have their surgery. And then post-operatively, what we found, like, for example, we're helping a lot of other orthopedic surgeons that are doing like ACL repairs, treating their ACL repairs with light therapy. We use a high intensity, photobiomodulation with a class 4 laser, but the results, not only are their wounds healing more quickly, but their range of motion, because their inflammation's going down so much, faster, is improving. So I agree at doing it, preconditioning and post-operative period, but then even intraoperative period by shining near infrared, we could really revolutionize the speed of healing and the success rate of the procedures.
But if you have an open surgical cavity, a lot of the barriers to light are gone. I mean, each photon is doing a lot, and the intensity may not need to be the same. I mean,
right, of course.
We did one series of experiments quite a few years ago, which failed, and it was to do with heart attacks in rats. And the idea was that you opened up the rat's chest, you induced a heart attack, and shone near infrared light. And what we found was that the dose of light had to be vanishingly small, because to start with, all the rats died, because we just kind of took what you would shine on the outside of a rat
Yes,
and
yes.
shine it directly on the heart. And I think the same would happen in the brain. So if you were shining light directly into a surgical cavity in the brain, you may want to turn down the intensity a lot. So just a few milliwatts you might
Yes.
need. as opposed to watts.
Back to your other idea of potentially having low levels, like, I mean, just things that you would absorb normally in just in light. Okay, like say we were doing surgery in the sunlight or something like that, but having those in kind of the operating rooms, shining on the field, you know, whether it's brain surgery or spinal cord surgery or limb surgery or abdominal surgery, would potentially make significant differences. And it would just be tiny doses that would be delivered, but that's all you need. And not to mention, it's good for the surgeons because we're getting, you know, we're getting near infrared light while we're operating. So maybe we're happier and healthier just by being in the presence of these beams just kind of shining everywhere, including the staff and everybody else that's in the room.
Well, time is marching on.
Yes, yes. So I would say that you're kind of the last thing I just wanted to bring up, since you you know, brought up this thing about treating you know, surgically, is I'm going to be chairing next year the Society for Brain Mapping. I'm actually chairing the spine division, and one of the things that I'm going to bring on some speakers to talk about utilizing photobiomodulation directly, potentially on the spinal cord, for the treatment of spinal cord injury. And there was something out of the UK, University of Birmingham, that they developed this little probe that you put next to the rat's spinal cord, and they showed improvement where you damage the dorsal columns of the spinal cord. Do you think that there potentially could be a role in the treatment of spinal cord injury with utilizing photobiomodulation?
Yeah, no, I mean, some of my collaborators have worked on spinal cord injury in rats, and photobiomodulation definitely has an effect. You know, a lot of them use kind of cell-seeded matrices that they put in the lesion, they create a lesion and they put it in, but then they use the photobiomodulation to allow the whole thing to sort of heal and integrate, and the axons to regenerate across the gap. Yeah, I mean, in people, I guess it would probably require inserting something through the skin, I'm guessing. I mean, you could try a class 4 laser, I guess, but Leonardo Longo from Italy treated patients with the class 4 laser, but he needed to do it for a long time. You know, that had to come, I don't know, at least once a week for many months or something like that. But he did
Yeah,
get results.
yeah, it's amazing. I think I envision, you know, like all these modulators coming out. That's something where industry may be interested. And you know, I've started some discussion of it, but utilizing red light, you know, in addition to you know, whatever other modulation they want to put in there, but actually having red light probes along the spinal cord. So for example, as a spine surgeon, we could fix the you know, the dislocation, and then you can use stem cells around the spinal cord at the level of the lesion, and then insert a photobiomodulation probe next to the lesion. And this might be the treatment of spinal cord injury of the future, with maybe dramatic results, because obviously we haven't come a very long way in reversing spinal cord, you know, injured patients once their injury is severe enough.
Now people are developing implantable radio frequency powered LEDs that don't need any wires. So you could pop a little LED in there with a radio frequency receiver at the time of surgery, and it's just like charging your iPhone. You just lay it on a radio frequency transmitter, so you would have something you put on your back every day to recharge the LEDs.
Yes. I mean, the future, you know, is bright. And again, you know, our time has run thin here. I'm going to sneak in one final thing. If you've got 2 minutes, Parkinson's disease, reduction in tremor. What do you think the future is, photobiomodulation for treating Parkinson's disease and reducing the tremor portion of that condition? I know in the primate models, it's really encouraging to see, you know, the reduction in tremor. And there's been some, you know, the case reports, very small studies on reducing tremor utilizing transcranial photobiomodulation. What are your kind of parting thoughts in that, and then we'll wrap it up?
Yeah, I mean, the Australians have been at the head of the field for Parkinson's, and they've done a lot of studies. I'm not familiar with the details of whether it's more cognitive things or tremor, certainly average movement, the things they film the gait of them walking and various other tasks and drawing clock faces and
Yes.
all these sort of things improve. Whether it's particularly good for tremor, I'm not sure.
Well, yeah, thank you. Well, on that note, we'll wrap it up today. I can't thank Dr. Hamblin enough. I can't thank you enough for being on the program today. I mean, it was just an incredible wealth of information, and I think that we're going to be able to have our audience take so much from this as you distill it down, because I think if they started reading through some of these studies, it'd be a lot for them. So just having something more succinct where they can just hear you just speaking about some of these topics. I know we were kind of, everywhere and just talked about so many different things in photobiomodulation. I think that this is exactly what people need to hear, and how promising, the research really is, and how now, we have to pick up on that and do the studies and treat people clinically. And a lot of it has to just be in the private sector, like our group is doing, to be just to treat thousands and thousands of patients, and then modify the protocols based on, what is working best. So again, thank you so much for being on the program today. Can't thank you enough. And just look forward to your work as you continue to, have so many collaborators around the world.
Yeah, well, thanks for organizing it, Stephen. It was good fun talking to you.
Well, wonderful. So everyone, thank you for being on another episode of Wellness at the Speed of Light. I hope you really enjoyed this, and follow Dr. Hamblin. All you have to do is Google him and look him up, and you can study him for hours. And if you want to, get some of his books widely published, he's got more articles than I mean, I haven't even gotten through, half of them, because there's too much out there, to learn and study on this dramatically evolving topic. So we'll see you guys next time on Wellness of the Speed of Light podcast. Be well, be healthy, and please learn more about photobiomodulation on your own, and so that you can start going down that rabbit hole like I did. We'll see you guys on the next episode.